Good evening and good to have you with us in this edition of the Urban Debate. Continuing with our Friday special 9 p.m. series where we talk about mental health in times of a pandemic. Tonight we take up another aspect because it goes without saying that with all the news of loss, with all the grief around us, with all the pain and the struggle, with the second wave claiming so many casualties, with now a second challenge coming in of a mucormycosis and what that could entail, there is just so much pressure, so much stress around us. We are all pretty much back to the kind of lockdown we were in last year. But for many, it's a lot more difficult because not only are you locked in within the confines of your four walls, struggling to go about your regular work, you probably know many within your family who've gone through really tough COVID experiences this time. You probably have. Your family may have. And going through COVID has left many completely weak. The weakness goes on for weeks together, brings about several other ailments. There are many of us who've suffered some or the other loss of a loved one. You get what I'm saying. There is just so much of stress and pressure and trauma that our mind has to deal with. And this now seems to be something that will go on. Second wave, we will come out of it, things will become a little better, but there may be another third wave as well and more. So it becomes very important for us to continue having conversations about mental health, to seek experts' advice on what are the symptoms to watch out for, what do you do in terms of helping out a loved one, how do you access good mental health care, what kind of help do you need to access basis what symptoms you may have, what problem you may have. And access is actually an extremely big challenge. Worse than the healthcare infrastructure facilities are in our country, we've never even thought about mental health care seriously. So we've not worked towards it. It's never part of your mainstream conversations. It's hardly ever part of your primetime conversations. It barely ever features in government's big budget plans and campaigns. It never ever features in anybody's election agenda. And so today we stare at a situation where India has 0.3 and 0.07 psychiatrists and psychologists per 100,000 population. That ratio doesn't even make sense. It's that bad. 7.5% Indians suffer from some or the other mental disorder. By the end of 2021, 20% may suffer from some or the other mental illness. It's a huge number that by itself can be called a pandemic, not as per the legal scientific terms, but basis how widespread it could become for us. 56 million Indians suffer from depression. 38 million Indians suffer from anxiety. And we don't have the kind of help which is required to help these many people. For every 100,000 population, every 100,000 people, we have 0.3 as a psychiatrist, not even one. 0.12 as nurses, 0.07 as psychologists, and 0.07 as social workers. Not even one, not even half. That's a metric you want to look at. How do we fix this problem? That's the conversation I want to have tonight. So let's say good evening to those who are joining us in this special series. Shamoli Desai, psychologist, joins us this evening. Dr. Santosh Chaturvedi, consultant psychiatrist, former dean and retired senior professor of psychiatry at NIMHANS, Bengaluru. Dr. Sheilu Sreenivasan, founder, president for Dignity Foundation, with us this evening. Shraddha Sidhwani, clinical psychologist, certified REBD supervisor, joins us this evening. Mimamsa Singh Tanwar, clinical psychologist and head for Fortis School Mental Health Program. also with us this evening. Dr. Chaturvedi, thank you for being back with us. Tonight we focus on access, Dr. Chaturvedi. And how do we go about fixing this huge gap which is there, even between those who may be wanting to and willing to go out and get help and those who can give that help?
So thank you very much. And I really appreciate your channel for, taking the cause of mental health on a very periodic basis. As you mentioned, it should be happening at various other circles also, but it is not, unfortunately, happening. So let me mention about, you gave some figures about the ratios. See, these are a bit deceptive, because we really don't know how many psychiatrists, how many psychologists we actually need. When we look at these, we look at the global WHO figures and look at it like that. For psychiatrists, I can say that at present, there are 1,000 postgraduate seats every year. And that is quite a large number. And it has doubled in the last 3 or 4 years from 450 to 1,000. I am not sure whether there is a shortage because there are no vacancies for psychiatrists anywhere in the country which are lying vacant. And then thirdly, for every job of a psychiatrist, there are 20 to 30 to 40 applicants. So either we should say there are not enough posts, or we should say that, the need, most of them are in practice. I would agree that there is a lopsided distribution of psychiatrists. Most of them are in cities or bigger towns, and very few are in smaller towns or, rural areas and places like that. Now, coming to COVID. Now, COVID has been a blessing for mental health. Right from the first wave last year, when the stigma for COVID-19 was coming up, the stigma towards mental health was going down. Suddenly, everyone, woke up to mental health. Even government tried, and various agencies tried, and lots of NGOs tried. The media tried, and everyone brought about the role of mental health. And I should congratulate you. You have very rightly pointed out the role of mental health at present. It's not only at present. You should wait and see in the next 5 years what new mental health and psychiatric problems are going to come up because of the COVID. I'm not talking about third wave. I'm not talking about, fear and all those, but post-viral complications in the form of what we call as chronic fatigue syndrome or cognitive impairments or long-term depression, long-term panic attacks, PTSD, long-term grief. These are the new psychiatric disorders. And of course, health anxiety is going to be a very important one. Some 5 or 6 new psychiatric disorders are going to emerge. Some are new, some are, they will become very explosive in the next few years. So you are right. We have to, we are sitting on a ticking bomb of mental health problems, and something needs to be done very, very urgently. And I would say another thing. At present, the role of a mental health professional is much more about counseling. And I'm so delighted to see that you have got 3 psychologists here. I think they have a very important role in providing counseling, in training counselors. And as a psychiatrist, the role of prescription of medication is at present in the back seat. We would also like to, train people in identifying disorders and being able to manage them. So, it's a very, very timely discussion.
Can you give us, Dr. Chaturvedi, before I go to the others, can you give us one example of some of these new, issues that might crop up as a result of this, pandemic era that we are living in?
Right. For example, PTSD is a post-traumatic stress disorder. Now people are, being revived. The old memories are getting revived. That this is what happened in the first wave. This is what happened last year. And they are panicking because of that. And now what we are seeing already, the dead bodies and people are not able to participate in funerals. These are the early signs of a long-term grief. And already people are complaining of bodily symptoms that they, even after, 15 days, 20 days, 1 month of having turned positive and then negative, people are still feeling tired. And some of these are very, these are going to be chronic complications of a viral thing, which we are already seeing. Health anxiety has become enormous. And partly it is natural, and partly it is pathological. Moment you find one of your colleagues coughing and sneezing, and then they think of getting all the tests done. At the slightest difficulty in breathing, they go for a CT scan. People are trying. We are seeing what is happening. People are trying steroids and antivirals. A lot of them is because of health anxiety and health panic. And this is going to land up with what we call as hypochondriasis in future, chronic health anxieties in future, and bodily distress disorders, chronic pain syndromes, and chronic fatigue syndromes.
Okay, so that's what we should prepare ourselves for. The big burst in such cases as well will happen. Let me actually bring in at this point of time Mimantsa Singh Tanwar as well. Mimantsa, did you want to add to this about the new or larger number of these kind of cases that we will see with all the news around us, with personally so many people going through so much loss of multiple loved ones, old friends, colleagues? How will we deal with this?
I think what we need to essentially realize is that these are uncertain times. And during these times, when you are facing with so much uncertainty, to have heightened anxiety, slight increase in your anxiety, stress is absolutely normal. In the given context, experiencing feelings of helplessness, hopelessness, anger, sometimes loss, grief, all of these emotions are absolutely normal. We are going through them in the given context. What we essentially need to realize is that when you are going through any of these emotions, you need to talk to someone. The problem is that we don't really talk to someone. We bottle it up inside. We feel that this is something that I need to handle it at my own level. It's important that we open up, we unmute ourselves. It's about our mental health. It's about our emotional well-being. And this is part of our day-to-day life. Right now, yes, mental health is being impacted for each and every one. And if we have to handle it at the level of prevention, we have to focus on the solutions. And the solution right now is talk to someone, whether it's a family member, with colleagues, friends, anyone, but you need to, or you reach out to on a helpline, or you reach out to a mental health expert. There is telemental health which has come in, which allows people even from remote areas to reach to a mental health expert. But the important key aspect that we need to recognize is that we must talk and share with whatever we are experiencing.
So let's talk about how do we do that? How do we go about, Dr. Sreenivasan, sharing or reaching out? One, of course, is that if you choose to reach out to people around you, to your family members, to your friends, whoever you are close to. The other is, when do you think you should reach out to a professional help? And because we are still in a kind of a lockdown situation in most parts of our country right now, how does one go about that? Dr. Sreenivasan.
I work with the senior citizens, and so what I'm going to share my experience really concerns the 110 million people who live in India for 60 years and above. Even not even talking about COVID, even otherwise, the life of a senior citizen is fraught with insecurities, financial insecurity, emotional insecurity, insecurity about the bodily health, and the social insecurity. Now, each one of these insecurities creates in a person a sense of fear, anxiety syndrome, for example, Dr. Chaturvedi talked about. These are sort of a perennial condition as far as senior citizens are concerned. And the pandemic has really heightened the depth of each of these problem. And loneliness, not having anyone around, is number one. Inability to go out and meet up with others is the second one. So a sense of nobody is there for me. What will I do? How much can I talk on the telephone or a WhatsApp is something that greatly upsets the mental health of senior citizens. So what can we do about it? Now, earlier times, through physical contact centers, for example, we have about 40 centers all India. Daily, on a daily basis, what we used to call euphemistically as a chai masti evening. So between 3 o'clock and 6 o'clock, senior citizens used to assemble, come together, bond with each other, have a good laugh and fun, and also take them to through a number of scheduled programs, which are by nature of information provision, motivation, because at 60, 65, 70, when the body is not responding that much, when it has slowed down, what is very important is to comprehend what is happening to you as you are aging. So, in while these daily bonding physically used to bring about a lot of sense of good, a feeling of, yes, others are also there, like-minded people. Even though I'm living alone, doesn't matter. There are these other people. But the pandemic has really put a stop to that. And we had to come up with, convert the physical Chai Masti Center, for example, into an online meeting on a daily basis. So every day, 5 days of the week, we organize structured talks, games, brain games, social connectedness, talking about their children, sharing one's own problems that are faced in life. What are the very constructive interventions that are happening in each one of these experiences? And mind you, these 40 centers are across various states of India. Therefore, a very rich variety of experiences are shared on a daily basis. And that is one form of a loneliness mitigation.
Okay, let me ask you this, Dr. Sreenivasan. You've where you work, the field that you work in, one very important aspect, and we've actually had viewers in the past, senior citizens who've called us and shared their fears with us, their anxieties with us, and a lot of it has to deal with, of course, being alone and being locked up. One of them had not stepped out for a whole year.
Yes.
And all of the fear about what's happening to their peers at that age, the loss of that, the anxiety that it may happen to you tomorrow, was adding on to his fears. Now, how do you, as a process, as a foundation, Dignity Foundation, how do you reach out to the senior citizens? How do they reach out to you? Do you go about reaching out to people who may need some amount of guidance in dealing with such issues?
That's right. So we do reach out through helplines that are functioning across about 7-8 states where we are present. And these helplines are advertised as elder helplines. And people do call us not just problems. For example, the problem of elder abuse has really increased during this pandemic period. Either they are living alone and being taken for a ride by whoever knows that they are living alone. Could be domestic helps, could be neighbors. Also, their own children. Elder abuse is something that happens within the domestic setup. So it is at the hands of people whom you know. It is not outsiders like robbers and thieves coming and abusing you. So elder abuse has certainly gone up due to this pandemic. And how do we reach out? Therefore, we have set up these helplines. People do call us and report to us not only about problems they are facing, but also how do I spend my time, or I don't know, all the shops are closed, where do I go, how do I do online. In fact, we do organize even mobile technology and digital technology, like how do you get into Zoom and share your experiences. So the helplines and the digital reach out through our own website are the ways in which we reach out to people. So you can say that, okay, the middle class and the people who are well off can use these methodologies, but and use these tools of connecting with each other. But what happens to the people who are living in the slum locations? Yes, that is where our social workers and volunteers do make a lot of difference. We run daycare centers where about 100 people come on a daily basis in these several 8 to 10 centers that we have, and they come. And now during the lockdown period, they are not able to come, so we reach out and talk to them on the mobile. So that has been our reach out methods.
Okay, okay. Yeah, interesting. On that note, let me also go across to Shamoli this. Shamoli, let's talk a little bit more about access and what is available out there. What are the various options that a person can look at? And I think the step one will be to see what are the available helplines in any city. But how do we go about it?
So, with regards to access in cities, I think it is, hospitals have a psychologist, they have psychiatrists, they have a psychiatry department usually. So that is a place where people can reach out. But of course, that would mean that they'd have to visit the hospital. So in times like this, it will have to be more online. It will need to be, through teleconsultations, which people will have to access through, I think, mainly looking for psychologists or psychiatrists more, via Google, or getting references from patients, from other people who require psychiatrists or psychologists. So I think that definitely helps. Word of mouth spreads, but awareness definitely needs to increase, as well as the discrimination which takes place, which leads to a lot of stigma. So that makes a difference to people seeking help, even though there is access.
Move on and bring in also Shraddha Sidhwani. Shraddha, again, I want to continue the conversation of access and what are the kind of solutions we can look at, especially in times of a pandemic where going to a hospital is not an option in many parts, where visiting a specific center is not an option for many people. So what are the various solutions then we can look at?
Since the pandemic has started last year, I think all doctors, psychologists have grouped up, and we have started multiple helplines for the public. These helplines have been absolutely free of cost, and the information has been circulating on social media. But primarily, I want to add on for certain concerns. And these concerns are related to children who have been doing online schooling since 1 year. So you can have adults doing online counseling, but it is very difficult for children to sort of open up on an online session. Children are the one who are going through frustration, extreme anxiety. A lot of children have attention deficit hyperactivity disorders who are getting very aggressive. Again, addiction rates have gone up. So coping strategies and coping mechanisms have not been taught. Even with healthcare workers, we've seen a lot of compassion fatigue. Compassion fatigue is that you get drained out in, putting in that amount of care for a prolonged period of time. And therefore, you see your sleep problems, your depression, your anxiety among them. Rates of OCD have gone up. Now, adults, like I said, are very capable of seeking online treatment, but we need to design a mechanism for kids. Also, coming on to the corporate world, a few companies have initiated some mental health programs. However, few companies are still in denial, you know pressurizing their workers to continuously work for more than 12 to 14 hours. So work from home hasn't been very efficient for especially women who are juggling between multiple roles. Even with grief, when we're talking about grief counseling has just been initiated by a few psychiatrists and psychologists. And I think on a large basis, we need to have community grief programs, so maybe area specific programs where we can have weekly meetings, maybe on Zoom, because if you can see that our entire process of grieving has changed. We as communities had a grieving, such a ritual, and we've lost that. Like doctor has said before, the loneliness aspect, so today when you're going outside even to work once a week, you're perceiving humans as threat because COVID is passed through humans. So I think this invisible illness has definitely increased anxiety. So I think corporates have to start corporate programs. Schools need to start programs on a weekly basis for all children, regardless of them reporting some concerns or no. And I think this needs to be added into the curriculum or the corporate organization.
Yes, and you're absolutely right that not too many corporates even now are doing it, and same goes for schools. Not too many schools are actually looking at as a serious active measure, Shraddha. In times of a pandemic, I think a lot of the focus has simply been on how to organize your classes online, how to divide the syllabus, how to go about teaching the same things online, and change your academic year plan. But how do we include mental health counseling guidance for children from the schools end as well? Then how do we do that?
So I think we do, as a mandatory rule, have counselors in school. All schools have to do is develop an emotional well-being program. These programs have been modeled and researched all over the world. All we have to do is get them to be applied in India. And I do know of some colleagues who have already started applying in smaller cities. So I think we need to be open in accepting that mental health, or rather than calling it mental health, let's talk about emotional well-being. And today, after COVID, I think it's important to rephrase mental health. So not all children will be depressed or anxious, but all children will need a component of emotional well-being. So I think having that included in your weekly classes, maybe with a teacher, have a counselor to assist. The HR department in the corporates can have mental health programs. I mean, because the online platform has increased so much for psychologists, we ourselves in India are getting calls from healthcare institutes, out of the country, because they are seeing a large increase in number of cases which they are not able to handle. So have more online platforms where you can source psychologists and probably tie them up to corporates and smaller organizations. But again, on a large scale, we do need community-based programs, area-specific programs, maybe district-specific.
From the conversations we've had in the first half hour, Dr. Chaturvedi, one thing that has also emerged is that you will need different approach and different solutions for different kind of people. Elderly are going through a very different set of challenges, and they will see a very different kind of impact than what children, especially younger children, will. Than what a student of a higher class whose career is currently uncertain, future higher studies is currently uncertain, those kind of pressures are different. So our approach towards even providing solutions and access to those solutions will also have to be different, Dr. Chaturvedi.
Absolutely. So for example, for children in school, and whether it's an online school now, which is going to be for the next at least year or two, we can accept that. So it's very important. One of the panelists mentioned about talking and listening and communicating and connecting. So it's important to teach the teachers in if they have counselors, that's well and good, but many might not have counselors. So to teach the teachers at least three roles. One is to be able to identify early any signs of mental distress or mental ill-being. Like for example, if they have a conduct problem in the class. Now what we are seeing, sometimes even if they are on Zoom, sometimes the child mutes himself, unmutes himself, disappears, puts the video off, and the teachers are calling out. So there are going to be new types of conduct problems for the school. But other than that, they might have other conduct problems, other behavioral problems, other emotional problems. So if the teachers can identify, that a person is having an early sign of a mental health issue. The second is how they could, bring about some amount of well-being exercises, well-being, activities. I don't want to make it very mundane like a class, but something which would entertain the child, keep their humor, keep them, motivated, and be able to accept that. And the third would be to prevent any mental health problems from happening. So in the school, these approaches can be added to the curriculum of the school teachers in their training and how they could do that. But you have talked about elderly and children. You're not talking about the youth. In this way, the problems have been with the youth. Infections have been more. There has been a lot of domestic violence. Already one panelist mentioned about substance use, a lot of drinking, smoking, poor coping methods which people have been using, and marital discords, sleep disturbances. A whole lot of things have been happening in the youth. And youth has become, it's very difficult to deal with them. And many times they will feel that, we can deal with it, we can cope with it. And these are very uncertain times. These are very difficult times. Let's go on with that. So we need to have a different approach for that. And for this, I would suggest one method. All the people who have, for example, any sign related to COVID infection, they will contact their doctors. And the doctors, besides being preoccupied, as they have been till now, about the signs of infection and lung symptoms and bodily symptoms, if they could ask one or two mental health related symptoms routinely, they will be able to catch a sign of a mental distress much in advance, then it is when it is too late. So just asking them, are they sleeping well every night? Are there too many thoughts, worrying thoughts in their mind? Are they losing interest in their surroundings? So there are 2 or 3 questions which will easily pick up signs of stress, signs of anxiety, and signs of depression. So the general physicians, family physicians, specialists, they are so very focused because of following the protocols. Unless mental health is put in a protocol, or from their side, they will not use it. So either they put it in the protocol or as a good medical practice, a more holistic practice, they should be able to ask that, how are they coping? And that would be one way of, identifying early any signs of mental health problems. And as one of the panelists mentioned, some of these are quite natural. That's not a problem with that. But when it becomes too severe, or it becomes too prolonged, or it is interfering with their life, that is when intervention is required. So we need to rope in not only mental health professionals, psychologists, social workers, nurses. Nurses is something which we have never talked about till now. All the nurses are giving injections. All the nurses are taking part in that, and they can be good counselors. They can be involved in, providing support, emotional support to people. If they are not trained, they can be trained, and to use as much of health professionals which are available. And of course, in the school, you use teachers. In corporates and industry, you use the HR, and you identify people. So, and people who are survivors, they can be very good. The warriors and those who have had an infection, have come out of that, they can be very good counselors. So they need a bit of training. I'm not saying they are natural counselors, but with a bit of training, we could have that. But this is what we are going to need for the many months to come. Yeah.
For many months to come, I think, which is why it's important that we begin to, and a lot of conversations have happened. Like our experts are also saying, there are various formats that people are trying online on social media, to have these conversations, to have community groups as well, to help each other out. Mimamsa, do you also want to come in on this part that we're talking about, especially for the younger minds, for students and children, and how to go about it?
See, my take on this is that I do believe that children have also handled this much better than adults. I think we need to understand that children are going to come out resilient in this. What matters the most for children is the immediate environment. So as long as parents within our homes, we are able to provide them a conducive, comfortable, supportive environment, children are going to come out a lot more resilient from these times. At the same time, I also believe, and I've been working with schools for a very long time across India. As a team, we've been working. There have been a lot of training which has been going on, and schools have been focusing on mental health care. I think, yes, of course, we need to keep on continuing to do this to be able to reach that last mile. But there are mental health curriculums which have started to happen. We've also been doing trainings for teachers and counselors on the same. Even counselors and teachers are focusing on the mental well-being, and they have programs running. It's just that we need to ensure that the sustenance of these programs are happening. So schools have been engaging a lot more in this, to be able to just recognize the signs for some children who do undergo some of these mental health related concerns, and when to help them, and also to work with parents to be able to reach out for help for them. At the same time, I feel that there is no one size that fits all. At multiple levels, we need to work. So yes, of course, there has to be trainings of social workers. Not everyone needs to reach out to a mental health expert. First, we need to understand that our immediate ecosystem, we need to seek help from that. So our families, our friends, our colleagues, we need to talk to them. When you realize that there are signs which are still continuing, where you're feeling persistent sadness, you're having mood swings, your sleep is getting disturbed, your appetite is getting disturbed, there is a general sense of, heightened, a lot of anxiety which continues to be there, that's when you reach out to a mental health expert, you go on helplines, and you, seek treatment at whatever levels that you can. Telemental health, like I said, is available, and even people from remote areas have been able to access mental health. We just need to continue to provide the information. So yes, information has been going on, being circulated on social media, but it needs to be sourced, it needs to be credible. That's what we need to ensure. And of course, like other panelists have said, HR, corporates, we all at multiple levels, we have to look at training. We have to look at a robust mental health system that we can build in organizations, schools, and even in communities for that matter.
Okay, fair enough. I was good. It was good to hear, you say how children are showing a lot more resilience and probably will come out more resilient and stronger than at least the adults in this. Shraddha, you wanted to come in before I move to the next point?
Yes, Tanvi, I wanted to just point out, it's been a year. We've seen cases of suicide. We've seen cases of mental health rising. We're all talking about it, but there is no insurance policy yet in place. So it is very difficult for people to afford mental health services. And I think a baseline is that's where we have to start. So once you have a basic insurance cover for mental health, even your basic medicines will be covered. And I think that is very, very important for the government to take action on.
Well, actually, we had earlier done some research on this, and I think that the indication even from the authorities and to the companies has gone. In fact, I do know of a couple of companies who've begun to now offer cover for mental health insurance as well, or rather for mental illnesses or any kind of disorders. Obviously, it will differ the kind of cover and what they cover in that. But yes, I think what you're saying is very important. There also needs to be a bigger push. There needs to be a larger conversation around this as well between the governments and the insurance companies which are currently there, and of course the insurance regulator. One other aspect that I wanted to speak about, and Shamoli, maybe you can comment on it, this was touched upon earlier as well. One big conversation point and challenge, of course, is the higher number of mental disorders or illnesses or newer kinds as well. The other is emotional well-being. To be able to go through these tough times and emerge out of it emotionally, healthy. Now, for that, which will obviously mean a larger segment of people, almost everybody right now is consuming the same news, is going through similar experiences, some worse than the others. Now, how does one person individually tackle that and ensure that they work towards emotional well-being for themselves?
Right. So I think, see, emotional well-being is going to be maintained when people make sure that they aren't just looking for a cure, but they're also looking for prevention, right? So that would include on a day-to-day basis, making sure that they're looking after their mental health in terms of now that they're working from home, maintaining a routine, sleeping on time, sleep-wake timing should be regulated. That makes a big difference to how you're feeling and how emotionally composed you are. It also definitely affects your work productivity as well. So sleeping, maintaining a good routine, getting exercise regularly, that helps elevate stress definitely, as well as socializing, speaking to friends, speaking to family, even if it is online right now, is a big relief. And of course, you do need to kind of, along with that, also trying as far as possible to maybe pursue a hobby. So making some time to take, to focus on something that is totally away from all this that we're all surrounded by. So focusing on something may not be on a daily basis, but at least maybe over weekends, if, something as simple as maybe gardening or painting or anything like that that can help relieve some of the stress that everyone's going through. So doing all this as well as socializing regularly as far as possible online. So speaking to family members, speaking to friends makes a big difference. It's a relief. And definitely trying as far as possible not to keep discussing COVID and all the complications and everything that we're surrounded by. So looking at socializing from the perspective of taking your mind off everything that is going on, that can definitely help kind of prevent further issues arising. But having said that, of course, sometimes it gets difficult because there are a lot of people who've already gone through very difficult times right now. So in case, you're not able to deal with that, in case you're not able to prevent anxiety and stress, then I think the next step would have to be to, get in touch with a mental health professional and take it forward from there. Whether it's counseling and then thereafter then see, how that goes, as well as maintaining your routine and maintaining other things that I just mentioned.
Okay. In fact, some of the points that you've made, I think one of our viewers who's on the phone line wanted to know on similar lines as well. Mr. Pushpendra is calling us from Aligarh. Namaskar, Pushpendra ji. Good evening to you. What would you like to ask?
Good evening, madam. Good evening. You people are doing very good program, Tanvi ji. But unlike your media, that the media peoples are, that the propagating and they presented their news, that in a very, that a style way, the sad news. So they should feel, a kind of, that sensitivity, what peoples are thinking nowadays. We all know what is COVID, and we cannot go to school or we cannot go to in playground or something like that, our children. But what are the causes due to which that one can reduce the, depressions? We have to emphasize, why the peoples are in the depressions, why we feel anxieties. So this is our responsibility, being a responsible citizen of this country. One should not present it, even that the future perspective as well, that it is necessary, to aware. But they should think, in this kind of things, because all people are not, that the mentally strong. Some of them very simple. So what I mean to say, that we have to be very careful, okay? And we should apply our efforts in a positive way so that one can reduce such kind of things. Right, madam? So please discuss, these things. Hello.
Absolutely, sir. Thank you so much. I got your point. Yes, absolutely. What you're saying is right. We must take measures to keep our minds, healthy as well. Not constantly watch all kinds of negative news around you. It is our job, of course, to bring the real news, what's going on, and to present it to everybody. But yes, I do get the point that if you watch it 24/7 constantly, just that it may begin to affect people as well. And that's where I think even our experts were saying you have to take a conscious decision, a conscious move, Dr. Chaturvedi, towards moving away from that, taking a break from it, take a break from television news that you're watching, take a break from your phone and all the messages and WhatsApp forwards and social media content that you're getting. Focus your energies on something that perhaps brings about some peace to you and some amount of happiness to you.
Yeah, I would like to make 2 points here, Tanvi. First is that the social media is the new social support. You know, just imagine if this pandemic had happened 20 years back, when we had to go outside to an STD booth or an ISD booth to connect to someone. It would have been so much more terrible. So the social media has been a very good support for everyone, people remaining connected, talking to each other and listening to each other. But another suggestion from what Mr. Pushpinder Singh said, that, see, the thing is that everybody will be watching news and will be seeing that what is happening, because things are happening. Now it is this, black fungus which has come, then so many drugs are coming and going. If we are not updated, it is very important. So I would suggest something to the media, that in your news, in the last 4 or 5 minutes, every half an hour, if you show something light, something with a sense of humor, something which would lighten people's mind, maybe even a story of a person who has recovered and come out, somebody who had a funny, encounter when they were in quarantine, or anything like it. Might not be related to COVID, should not be related to COVID. But if there is something which can, 25 minutes news, 5 minutes something funny or something light, and something, or maybe spiritual or motivational, again 25 minutes news. So, one would get the benefit of both the things, because I think it's very important that the media is projecting what is happening, because this will create some amount of fear in people, and otherwise they will just become fearless. And like I have been saying, jo dar gaya, wo bach gaya. And news has been, probably, indicated to the people what is the gravity of the problem. And despite that, people are still not following most of the preventive rules, as they should. So you should maintain that. I'm not saying be deceptive. I'm not saying hide the news, but let the news be there and let there be something else also in between, so that people can see that this is what life is. It has a sad part. It has a happy part. Even at present, the happy part is a little less, but nevertheless, life goes on, and, one has to deal with everything.
Yes. Oh, yes, absolutely. In fact, I must tell you, Dr. Chaturvedi, we also do a daily show twice a day where we also bring stories of inspiration. People, regular people like us who are out there helping others, going out of their way in times of a pandemic to help those who may need shelter, medicines, senior citizens, workers currently out of jobs, who may need transport, or money for those ticket fares, all kinds. And there is so much of goodness, and I think that's also our way of spreading about some amount of positivity and goodness, while we bring the other news to our viewers as well. That being said, if I can just go to one more talking point that I wanted to ask everybody on. And Dr. Sreenivasan, we've had a patchy connection with you, but I'm told that you're now back with us. That aspect is of the people who already have some or the other condition for which they have been seeking help. How tough has the year gone by been for them? And then how do we ensure that priority is also given to those people, and we keep on engaging with them and providing them the necessary professional help? I think we've lost Dr. Sreenivasan again. So let me actually take this question across to Mimantsa Singh Tanwar. Mimantsa.
I think what we really need to realize in the given time is that our support systems are very important. We don't, if you want, at the level of prevention, we have to understand that our families are there to help each other. Friends are there to help each other. And that's what we need to ensure, that at the level of prevention, as families, we are able to come together, as friends, colleagues, we are able to come together and support each other. At the same time, what I also feel that in the given time period where, we don't have luxury of time, we are managing multiple things and responsibilities, multiple roles that we are doing. We have to ensure our own mental well-being as well. We have to take out those pockets of 5, 10 minutes of positivity, of optimism, of bringing that element of fun and humor in our day-to-day life. Me time at this point in time, we have to consider it as a first aid. There has to be an unwinding time that we bring in before sleep. As families with children, there has to be that sense of playtime that we are able to ensure. These are elements which will help us bring in that element of positive, which is very important in the time that we are in. So our optimism, our spirit of taking one day at a time, we are in the second wave and we are already talking about the third wave. We don't even know what's going to happen. What we need to essentially understand are two things. That at the level of prevention, one is we continue to follow our precautions and we come out much better than we did from the first to the second pandemic. And the second is at our own level, individual levels, how good and how well are we able to build our support systems, continue to stay connected, interconnected, and ensure that at the positive level, we are able to take care of our mental well-being. Consider that as a first aid.
Well, I think that's a very well put across idea, and we're going to use that as the time to now wrap up this conversation. We'll have many, many more, and this is my appeal to and request to our viewers as well. If there are specific aspects that you would want us to talk about with our mental health experts, then do drop in a message to us on Twitter, and we will pick it up in our coming series as well. Big thank you to all of our panelists who joined us. Viewers, cannot emphasize on it enough. While there may not be an claimed shortage of mental health care professionals, basis the vacancies that are available, we still don't have enough in our country. And I think that's where the role of the governments along with private entities will come in, to set up more institutions to train professionals, to set up more institutions to then employ these professionals and let people know that these are your options, from helpline numbers to counseling centers in schools, counseling centers for senior citizens, for all categories of people as well. Corporates will also have to step up and do their bit when it comes to taking care of the emotional well-being and the mental health of their employees. I think 14 months into this pandemic, one thing is very clear. This isn't going away anytime soon. Things could get better, things may get worse. We're just gonna be living our lives in similar fashion for some time now. And so it is even more important that we recognize the need to take care of our minds and our mental health and our emotional well-being. Read up on it, learn more about it, watch out for the symptoms in yourself, those around you. Also read up on how to help somebody around you. What should you do when someone is in a tricky situation, reaching out for help? Think about it. Thank you so much for joining us.